This video demonstrates a procedure to image corneal C fibers using the non-invasive technique of corneal confocal microscopy, or CCM, enabling quantification of nerve fiber damage. First, the focal plane of the lens on the CCM is adjusted and visco-tear gel is applied to the lens before fitting the disposable cap. Anesthetic drops and visco-tear gel are then applied to the eye. Next, the camera is adjusted to make contact between the gel on the front of the lens and the patient's cornea. Finally, the depth of the focus plane is adjusted and images of corneal nerves from the central part of Bowman's layer are captured. Morphological changes in corneal nerve fibers can be observed that quantify neuropathy.
This is a very novel technique which has actually previously been used in the world of optometry and ophthalmology, but over the past 8 years or so we have used it very effectively to study and assess diabetic neuropathy and other peripheral neuropathies. And the main advantage of this technique is that it allows you to quantify small fiber damage at a very early stage and then stratify the severity of neuropathy in the patients entirely non-invasively. And we can do that very rapidly with a 2-minute scan, which can then be quantified in terms of severity of neuropathy. And therefore this, we hope, supersedes some of the other much more invasive techniques such as skin biopsy and nerve biopsy.